Hello everybody. Today we will learn what is Cpap and Bipap, or what is the difference between Cpap and Bipap. So what is Cpap and Bipap? They are forms of non-invasive ventilation. That means it is not invasive. Example for an invasive ventilation is mechanical intubation or endotracheal tube. So they are non-invasive form. And they are positive airway therapy. What is positive airway therapy? That means air under pressure is given to the airway and it helps to keep the airway open. So they are forms of non-invasive positive airway therapy which uses compressed air or pressurized air to open and support the airway. Now Cpap stands for continuous positive airway pressure and Bipap BI stands for bilevel positive airway pressure. Both Cpap and Bipap has machine, and this produces compressed or pressurized air, and it is given via a hose and a mask system. Now let's compare between Cpap and Bipap. In Cpap, you can set one single pressure. That means when a patient inhales or exhales, the same pressure is maintained throughout the respiratory cycle. Whereas in Bipap, you can set two different pressure. One pressure for inhalation and one pressure for exhalation. And usually inhalation pressure is higher than the exhalation. So the pressure set for inhalation is called inspiratory positive airway pressure, or IPAP. And the pressure set for exhalation is called expiratory positive airway pressure, called EPAP. So EPAP is usually lesser than IPAP. Cpap, you can set pressure anywhere from 4 to 20. It depends upon the patient need and the physician order. Whereas in Bipap, you can set pressure higher than Cpap. Now let's see the indication of Cpap and Bipap. The indication of Cpap include hypoxic respiratory failure. That means any condition that leads to hypoxia or decreased oxygen. Patient need more oxygen. Example CHF. Another indication, one of the main indication for Cpap is obstructive sleep apnea. That means the patient or the individual experience pause in breathing, or they stop breathing while asleep. And this is because when they sleep, the muscles relax and it will obstruct the airway. So the patient may experience pauses in breathing, and they may wake up, or they may pause in breathe and then they start breathing again. So patient with obstructive sleep apnea, Cpap is given. This pressurized air given through Cpap will keep the airway open. Now going back to the Bipap, one of the indication of Bipap is again sleep apnea or obstructive sleep apnea. If not responding to Cpap, if Cpap is not effective, doctor may have to prescribe or consider Bipap. Another indication is hypercapnic respiratory failure. That means respiratory distress or hypoxemia associated with hypercapnia. That means decreased oxygen. Along with that, if there is an increased carbon dioxide. Example is COPD. Another indication is central sleep apnea. Sleep apnea that is caused because the brain does not send signals to the muscle to control respiration. So again, it's central sleep apnea and CHF. Regarding the cost, Cpap is cost effective or cheaper, whereas Bipap is more expensive. Now let's see how Cpap and Bipap helps, or how the positive airway therapy helps the patient. The benefits are, it decreases atelectasis. Atelectasis means collapse of the lung alveoli. So in Cpap and Bipap, pressurized air is given. This pressure helps to keep the alveoli open. So when it remains open, what it does is it decreases the atelectasis. Another indication is increased ventilation perfusion matching. V stands for ventilation and Q stands for perfusion. So the alveoli remains open, more air move in and out of the lung. As a result, the ventilation increases. When there is an increase in ventilation, what happens? There is a good perfusion. You are increasing the ventilation. As a result, better gas exchange happens. That's called VQ matching. When VQ matching happens, better gas exchange happens. As a result, it improves the oxygenation of the patient. Now at last, you should know when a patient is placed on positive airway therapy, what are the key points you have to monitor, or that shows the non-invasive ventilation is not enough and you may have to consider an invasive ventilation. So what are the points? If hypoxemia, that means decreased oxygen, or hypercapnia or increased carbon dioxide is not improving. It still remains the same. Patient has low oxygen or high carbon dioxide. If it is not improving with CPAP or BiPAP, consider invasive ventilation. Another indication is patient has complaints of nausea, emesis. These patients placed on BiPAP are at high risk for aspiration. They can aspirate the gastric content into lungs, leading to aspiration pneumonia. They should not be placed on BiPAP. Another is copious thick secretion. This needs to be suctioned out, or patient has to cough out these secretions. Another contraindication or key point you have to monitor is continued exertion, increased respiratory rate, or no improvement in work of breathing. Patients are placed on BiPAP and you still see patient having shortness of breath, tachypneic, using accessory muscles, abdominal muscles, and if there is no improvement after placing on BiPAP, the patient need an invasive ventilation. The last indication is obtunded or unconscious patient. These patients cannot keep the airway open. They can have obstructed airway. As a result, invasive ventilation is an indication. So today we learned about CPAP and BiPAP and the main difference between CPAP and BiPAP, and thanks for watching my video.